Okay, I'm going to go through the pediatric and infant functions of the Philips on-site AED. It's much the same as the adult, but I think it is important to go through this. The first thing I'll mention to you is that the pediatric and infant cartridge for the on-site is for victims who are 55 pounds or less. So it's important to at least have some idea how much they weigh. If you don't know, I would encourage you to use the adult pads. The American Heart Association is very specific that you can use an adult dose of energy on an infant or a child. It's not optimal, but in the absence of having pediatric functionality, certainly an adult dose of energy will not hurt an infant or a child. So before I go any further, understand you can use adult pads on an infant or a child, just not the most optimal thing. With that said, I will show you, as you're already familiar, this comes with an adult pads cartridge installed in the device. So if you do need to use the pediatric cartridge, typically it's going to be housed back in this little garage area. So I'll take this out and just show you, I'm not going to open this. This is a real pediatric infant cartridge, so I'm not going to open it up, but I will show you what it looks like on the outside. It has pink on it to denote that it is infant child, and you also notice on the front here, as I'll show you on the training pads in just a minute, it's a front of the chest, middle of the back pad placement as opposed to upper right and lower left as we would place on an adult. So I have some pediatric and infant training pads here, and in real life, if we needed to use this, we would pop the adult cartridge out.
Insert pads cartridge. Infant child training pads. Training. In case of emergency.
Okay, so we have our infant and child pads in. On our child mannequin here, you may notice a piece of foil that is around the mannequin itself. That is there simply for training purposes. The training pads have to see connectivity, so use a piece of foil to accomplish that so the unit will go through the algorithm. So just as in we do with adults, I'm going to turn this on and go slowly so you hear the prompts.
Infant child pads. Begin by removing all clothing from the patient's chest. Cut clothing if needed.
Again, important that the chest be clear of any clothes before you try to use an AED.
When patient's chest is bare, remove protective cover and take out white adhesive pads. Look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic
Again, we see the pictures, just like an adult, but we have middle of the chest, middle of the back.
Look carefully at the pictures on the white adhesive pads. Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
Put the back one on. This one obviously going in the middle of the chest.
Look carefully at the picture on the second pad. No one should touch the patient. Analyzing. No one should touch the patient. Analyzing. Shock advised. Stay clear.
So again, we'll make sure everyone's clear.
The flashing orange shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button.
So again, we have our CPR assistant, so I'm going to go ahead and push that.
Place the heel of one hand in the center of the chest, between the nipples. For patients less than 1 year old, use 2 fingers instead of the heel of your hand. Push the chest down firmly. Keep time with the beat.
Again, our metronome, 100 times a minute, consistent with current Heart Association guidelines.
Pinch nose, tilt head, and give 2 small breaths. Breathe. Breathe. Continue with compressions.
And I'm going to go ahead and turn the unit off for the sake of brevity, but it will go through that for 5 cycles or 2 minutes, just like an adult. Then you would allow the unit to reanalyze. So you notice a couple of different things. For a child, you may just use one hand. You still want to be compressing the chest 1.5 to 2 inches. For an infant, would be 2 fingers right in the middle of the chest. So Much the same as an adult. We do have a different pad placement. You notice the breaths were a little quicker for a child as well. But that's the pediatric and infant functionality for the on-site AED. And again, if you have questions, please contact us or contact your local sales representative for Southeastern.